geometry here, and around 5 to 6 premolars. Third group, and the high-speed drill group. And this chart is with the results. I think it's very interesting here for you. Of main importance is the last column. Here are the excellent results without micro leakage. So you can see in the rows, this is the first group with the largest energy used and the average of 6 watts. You see that without micro leakage, 55%. And with I divided the assay in a changing filling color and the penetration in the tissues of methylene blue. So 2+ means that we have penetration more than 1 millimeter into the dentin. So because the cavities are prepared in equal size and depth until enamel-dentin junction, we see at the dentin on the microscope, and we measure that there are more than 1 millimeter penetration in dentin, and we set 2+. If it's until 1 millimeter penetration, we set 1+, and if the filling color is changed, we also set 1+. So, but there is some specimens that have a penetration in the tissue, but not in the filling color. So, and with 2- is without any penetration. So the best group is with the QSP etching mode. I told you that I added the etching, but if you do it on the same speed like you do it on the MSP mode, you will get worse results because it's going deeper and you don't have so flat and so smooth surface like in a MSP mode. So you have to be faster to be good and have good adhesion. For the QSP mode, you have to work faster. It took some experience, and you see only one specimen from this group show the micro leakage in both ways. And about the high-speed drill, you see with more than 1 millimeter, there are 30% of the specimens, and with the excellent results are only 4 or 15, so it's less than 30%. Big amount have a penetration in the tissues, but not in the filling. So that's why normally the turbine makes the cracks in the enamel, and in the but the filling is done after this preparation, so it's normal that we have penetration in tissues but not in the filling, not changing the filling color. MSP group is also very good. We have, because of larger energy inside, we have 3 specimens with penetration in the tissues, but not in the filling, and 1 in penetration with both ways. In our group with QSP mode, but without etching, we have 80% success with excellent results. Only 1 with penetration in the filling, and 2 with 1 until 1 millimeter, up to 1 millimeter penetration in both ways. So I will left a few seconds more to see this chart, and you can write if you have some question about this, because I think is the main of main importance in this presentation, this chart. There is average speed I used, so this is 4.5 watts. So you see that you don't need 20 watts, you don't need 10 watts. 6 is too much. because you got a lot of energy. 500 millijoules of energy is a too large impulse energy, and it works very fast. After you will see in a time split, it's really fast, but it's rough, and it's good for beginning of preparation only. If you have to remove some old filling and a big lesion of caries or deep carioso dentin, but in deeper layers you have to use reduced energy, around 300 or 200 millijoules per pulse. So here we have 9 watts average power. It's 300 millijoules to 30 hertz. With the high speed we have 19 watts, but this is not the same power like is measured in laser machines, so it cannot be compared. I think we can go further.
Dr. Mironov?
Yeah?
There's a question here. It's kind of a summation. So what your chart in your study is showing is that both the MSP and the QSP modes have very high levels of success, not without any micro leakage, but with the high speed, you're actually getting a lot of micro leakage. Is that correct?
Is less than 30% success. With the high speed, you got less than 30% of success. This last column is a success column. It's a success, and these all are failed, these specimens. So we start from worster and going to better.
Yep. Okay, thank you very much.
So the best is QSP and MSP, 2 kinds of QSP used, and MSP. Maybe I think I got some, I think I got maybe a little mistake in etching with MSP, because maybe I was too fast because of my habit to work with QSP, and I got faster moving here, and when I move faster here, the etching is not sufficient. I think there is some, maybe this percent will be a little bit higher. I think it's around 80% again.
Great, thank you very much.
Do you understood me what I mean?
Yes.
So when you have a habit to work faster, because last 6 months I used preferably QSP mode because of these experiments, and I got a large clinical research also with the QSP, and maybe some of my samples I passed through too fast. I passed too fast with the etching procedure, and maybe there is a little mistake in this percentage. Okay, I go further?
Yep.
Okay. So these are pictures from the samples. You see here the micro leakage, and the color of the filling is changed here, but there is no micro leakage toward the dentin. It's with from the first group with 500 millijoule. This is 1, this is 5, so it means it's a first group, 5th sample. This is again for the first group, 4th sample. You see here is a penetration in the enamel on the borderline, you see here, and slightly changing the color of the filling. This is one sample from the second group. You see clear the penetration towards the enamel and dentin, but it's less than 1 millimeter. You see here again from the second group